Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. I'm going to be doing a video about personal experience really of grief and trauma and attachment in order to be able to try and answer the question, are you not over that yet? Which is a very common question that I hear people talking about when it comes to someone's loss. A person or an animal or pet has died and there's often a critical judgment towards that person about the speed at which they should be over it. And I wanted to use some personal reflections on some recent traumas of my own to try and understand how we can answer that question on an individual level. Obviously, the traumas that I'm going to be talking about are not in any way, shape or form in comparison to the kind of traumas that the patients in our clinic or in the wider sort of trauma community have experienced, certainly sort of early childhood trauma. I'm not talking about any kind of comparison. I'm simply offering some recent traumas of my own in order to be able to help understand the range of this question and to try and look at it in a compassionate and thoughtful way. When I'm talking about trauma with my experience, I like to use the phrase trauma with a small t. I'm not talking about the sort of trauma that would be considered diagnosable as either PTSD or complex trauma. That's a very different thing, and that's the kind of stuff that we work with in the clinic. My experiences are more the everyday sort of small traumas that pretty much everybody will have experienced at some point in their lifetime. It's almost guaranteed that we're going to have issues of loss and grief in our life. If we live with other people, if we share attachments with people or animals, then these are inevitable that these are going to take place. And the link between grief and attachment and the complicated nature of that is a wonderful area of research that's been done really well. You could look at sort of Shear, and in 2005 is a good example of a sort of the psychobiology, the developmental aspects of this to try and really understand sort of why our loss and why our grief can be so complicated and the relevance to attachment. So please do go out and look at some articles and do some reading on that if you want to know more about it. It's a huge field. The question then, why, aren't you over it yet, or why aren't you over it yet? These are things because people want other folks to be over things, because the distress that a person experiences when they experience grief is very difficult for other people to comprehend and to tolerate. So people's sadness, people's abject despair is very difficult for other people to tolerate. It makes folks uncomfortable, and therefore there's sometimes a wish for it to be over soon. Please be over it. Is almost the statement behind some of these things. Not always, but you can see that that's the case. So we have these relational aspects to our grief. Some people will understand the grief, some people will not. So if it's let's say the loss, the death, for example, of a child, pretty much everybody understands that that's an enormous grief that's going to take a long time to get over with. But if it's, say, of a cat or a dog or a bird that is a pet, then some people are going to be understanding if they have an attachment to those kind of animals, and if they don't, they won't. So a farmer who loses a cow might be absolutely grief-stricken, but another farmer will be like, what are you talking about? It's just cows. You've got hundreds of them. They die all the time. And a pet that dies, depending on the circumstance, people can feel very compassionate and thoughtful towards that, or they can be quite kind of critical and say it's only a cat. So we have to really understand the individual nature of a person's attachment to whatever has been lost. Now, I give a couple of examples of this. So one is of one of my cats that I had that died over 6 years ago, Brittany, who was an absolutely wonderful cat and I was deeply attached to. She died very suddenly without any warning. We had no idea she was ill. I literally came home from work today and she had died. That's what cats do sometimes. I can only really describe my experience of that as profound and deep despair. I was absolutely heartbroken, to the level where anytime I listen to a specific Jake Bugg song, it reminds me of that experience. It reminds me of Brittany, and I can just burst into tears at the drop of a hat. And that was the song that I was listening to when I took Brittany to the vet, basically to be cremated. So I have an attachment with that song as much as with my cat. And I can really feel sadness, and I can feel it coming in now, just talking about it. So I know that there's a traumatic aspect to this, because this was 6 years ago. I've had many cats in my life, and I'm okay with some of them having died, and some of them I'm really, really not. So I know that there's a traumatic aspect to that attachment, that sudden, unexpected death extremely painful, very, very deep. 6 years later, it's still happening. If someone was to say to me, aren't you over it yet? I'd feel quite insulted by that question, because it would feel like it's somehow demeaning my attachment to that cat, Brittany. And I still have a very deep attachment to Brittany, even though she's died 6 years ago and I've got many cats. It's still there, and that's my right, my own experience to have that reaction. I can't really explain it. I don't really want it to be any different than it is. It's there, and that's what it is. Now, last week my stepfather died. Again, that was after a short, sudden illness. It was quite unexpected, but he was also quite old. I have a very deep attachment. I've known my stepfather ever since I was 5 years old, and we have had a great relationship for many years. But my reaction to my stepfather dying completely and utterly different to that of my cat dying. Now, I'm not going to say one is more important than the other, because that's a ridiculous conversation to get into, but my reaction or my responses were incredibly different between the loss of a cat and the loss of my stepfather. Very, very different attachments taking place. One is this abject, gut-wrenching, heartbreaking despair. The other one is just what I can probably best describe as a deep melancholic sadness that I still feel. It's only been a week, so of course I'm going to feel this level of pain and sadness. I don't know how long that's going to go on for. It might be that will be there with me for the rest of my life, or in a month's time I might be absolutely fine and it's all done and dusted. I have no way of being able to predict that, so therefore there's no way of knowing what's the right time to stop feeling this. Even if we had the control to just click our fingers to just say, boom, there it is. We are going to stop feeling like this. I'm going to stop feeling like this. Everything is okay. There's no real way of being able to do that. So the attachment lasts at different levels of our being. It might be very on the surface, lots of sadness, lots of grief, very obvious traumatic reaction, or it could be quite below the surface and it resonates at different levels of our being. It shows the complicated nature of this, that grief and loss and trauma and attachment are all held within us and in our relationships to everybody else. It can play out in dissociative elements, so some loss, suddenly certain loss, can result in derealization, depersonalization experiences. We can experience hallucinations. We can believe we're seeing or hearing the person. We can believe we feel their presence around us, right? So these are very, very complex responses and reactions to that loss. It can depend whether the loss is sudden or whether it's expected. The depth of the attachment figure. Are they someone who you're attached to but that might live in Australia and you haven't seen them for 20 years, even though there might be a childhood friend? Or are they someone that lives with you in the house, that their loss means that they are not going to be with you on a day-by-day basis? These all really introduce elements of the variability of our traumatic response that make it so individual, and therefore make it impossible to answer the question, aren't you over it yet? Because at what point should you be over it? 5 minutes, 5 days, 5 years? It doesn't really matter, but the question exists. People ask that question. It's not a question that really does anybody favours, because it simply implies that by not being over it, you're doing something wrong. Now, I would hate for somebody to look at my experience of the way I've responded to the loss of Brittany, or the way I've responded to the loss of my stepfather, as being wrong, because they're not. How can they be wrong? They're my emotions. That's what I experience. I haven't planned them. I haven't developed them in a conscious level. They are simply part of the experience of my entire life, and it helps me understand the nature and the way in which I attach to people or pets or objects around me. Some things might be lost, and that introduces enormous grief. Some things or some people might be lost, and the grief is not really acute, but it might last for many, many years. For example, the rest of my life. I will always not have my stepfather in my life, so therefore I'm always going to have a loss in my life. And the manner in which I deal with that might vary over the years. It might be completely fine now, but in 2 years' time it might be really not fine. I have no way of being able to predict that, so therefore the question becomes pointless. And we have to think about what's the intent of the question coming towards us, rather than creating an answer other than, it's kind of up to me how I respond to this. And in a very gentle and a thoughtful, diplomatic way, it's been able to kind of push that question away and say, oh, it's not really a question I want to get involved with. to think about this in summary then is to look at any grief, any loss. So whether it's the grief of a period of life that's been lost, or it's the grief of a person, or it's the grief of a pet, or it's the grief of an object, loss is intrinsic to our relationship to our own world and our life and our lived experience. We cannot exist without loss. We cannot exist without attachment to things. We have these things in our life, whatever they may be. It's an entirely individual aspect of our experience, is how we attach and how we deal with loss. So therefore, everybody has a right to manage and cope with their loss in the right way. Obviously, for some people, the severity of the traumatic or grief reaction might actually intrude on their life in a way that they can't then function and can't manage and can't cope with everyday life. And therefore, there comes a certain period where that's normal. So the loss of, say, a loved one, you would expect there to be a very high, intense, acute response very quickly, and that to last a period of time. If the person is still not functioning in life, like 6 months or a year later, and they're having flashbacks and they're having intrusions and they're having avoidances, behavioural responses, and their life is collapsing, they are having what's probably more likely to be a post-traumatic type response, like a severe maladaptive response. That requires help. The question, aren't you over it yet, still remains pointless. What we have to think about is, gosh, you're still struggling with that. Look at the effect that that's having. Do you want some help? We can help with that. So we start looking at different questions and the way we help that person understand and work with their traumatic grief reaction. So we have a separation between the normal reactions, which is the sort of stuff that I've been experiencing about the loss of my cat and my stepfather, and we have these enormous, huge reactions that many people experience, and especially those that then go into trauma-based services like our own here at the clinic, to receive sort of professional help in order to be able to get their life back on track. That doesn't mean they're going to stop feeling grief, and that doesn't mean they're going to stop feeling trauma, and the attachment and the losses will still be there, but their life is not being severely affected from it. So that's the difference between those two things. I can experience that deep traumatic loss of my cat, or I can experience this deep melancholic sadness of my stepfather and still be able to function. So at this moment in time, I don't consider myself in need of professional help for either of those two things. But if I did, I would go and look for it. That would be the reasonable response. So time is not the issue here. It's how we manage ourselves, how we look after ourselves. And what we want really is to engage with people around us, to be given compassion and thoughtfulness, not judgment and criticism. I hope that's answered that question about that sort of common thing, why aren't you over it yet? It's just a nice way of being able to look at it, to realize that our own experiences are extremely individual, massively varied, can't really be predicted, and therefore it's about more understanding rather than trying to push these responses away. They're our emotions, and we should be able to handle them and look after them in the best way we can. Hope that's been an interesting topic for you. It's something that I thought might be useful. It's something that I really wanted to talk about as part of my experience in the last week or so. It's just a nice thing to be able to have a conversation with you about. So I hope you found this helpful. We'll obviously keep producing content on the CTAD Clinic channel. Got loads more subscriber questions to answer, and people are giving me new questions and topics all the time. So thank you very much for that. So in between now and the next video, please take great care of yourselves.